we'll do everything that we can to get to all of those. Okay, so welcome everyone. We are about 3 minutes away from beginning this presentation about herbal medicine and trauma recovery. And for those of you who are joining us through the recording, I hope that you'll reach out to me personally if you have any questions that aren't answered in this presentation, if you don't have the ability to ask a question here on the line. And those of you who are here live, just a reminder, you can use that question box in the webinar screen in order to ask any questions that are coming up for you. So before we begin, one little final extra treat for those who are here a couple minutes early, and something for those of you who are at home. I really believe that one of the most important things when it comes to working with the trauma of any kind, whether you yourself are a trauma survivor or you're working with people who are trauma survivors, the most important thing is to really understand and have kind of a state of safety and groundedness within your own being. And it's something that I think can get missed a lot with herbal education. We don't get a lot of training in clinical skills necessarily. There's so much to learn with the plants. And this, I think, is something that can't be missed. So let's go ahead and just practice for a couple of moments here before we begin a little bit of what it feels like to ground and center into our own hearts. And this is a practice that comes from the Institute of Heart Math, which is a wonderful resource that I think we could all avail ourselves of. And it's a 3-step process that they call coherence. And this has been shown to have some very profound effects on heart rate variability and all of these various measures of healthy vagal tone that we'll be talking about in a moment. But before we get into our heads, I want us to experience it in our bodies and our hearts. So before we start the practice, there's one thing that you need to kind of know or think about in advance. And it's just to bring to mind something that you appreciate, the feeling or the emotion of appreciation. So best not to choose a human being because they are changeable. We have many complex feelings about human beings in our lives. You might think of a plant that you really appreciate, that you have a strong ally relationship with. You might think of the feeling of sinking into your bed after a long day, or the sweetness of the face of your dog or your cat when you greet them. Something that you appreciate. And just call that up in your mind and do that more and more vividly until you feel something in your heart, until you feel some appreciation there. And then we're going to come back to that. So we'll use that image or another one once we begin this practice. And this is absolutely something to use with yourself as you work with clients, and also something to teach to your clients. So the first step of coherence is heart focus. So we simply bring the focus of our minds to noticing the area around our heart in the center of the chest. Just bring your attention to the area around your heart, not just on the surface of your body, but inside. After a moment of heart focus, we're going to start heart breathing. So imagining that as you inhale, you're breathing into the space of your heart. And as you exhale, you're releasing from the heart space. So breathing in to the heart and exhaling, letting the heart fall down and rest very gently. Just a couple more moments of heart breathing. Now continuing this heart focus, heart breathing, bring in a feeling of heartfelt appreciation using whatever image you thought of before we started. I'm thinking of my dog because she's snoring loudly behind me as I sit here. Just a couple more breaths. And if you're not feeling much, add a little bit of a smile. Put a little smile on your face and kind of bring that up into your face. We'll talk about why that's effective a little bit later. One more breath and exhale. And just take a moment and notice what happened as you did that practice. What were the internal feelings like? And if you would like to reflect on that, you can type it into the chat or into the questions, and we might come back to it later. The idea of this practice is to bring you into a state that is conducive to your whole body and mind functioning optimally. And it's a very important thing to take care of ourselves when we're working on trauma. So I want to start this presentation with a little bit of a nod toward stories, mythology, and artistic ways of knowing and understanding trauma. Because even though our notion, for example, of PTSD is relatively recent, there is a very long tradition of describing so many of the things that are common features of trauma in mythology, in classic texts, and then certainly it is expressed in art and music. So this quote from Henry IV, I think really gets a lot of it. So think about what are the hallmarks of trauma that you're hearing Lady Percy share here as she's speaking to her husband. Tell me, sweet Lord, what is't that takes from thee thy stomach, pleasure, and thy golden sleep? So already there's digestive effects, right? Loss of appetite, loss of pleasure, anhedonia, inability to enjoy what you have once enjoyed can also be a feature of depression. And then thy golden sleep, of course, the sleep disturbance being a hallmark of traumatic injury. Why dost thou bend thine eyes upon the earth and start so often when thou sittst alone? So there's the downcast gaze, there's sort of the change in posture. And then she's talking about hypervigilance and reactivity. Why do you startle so much when you're sitting by yourself? Why? And so TCM, Chinese medicine practitioners, listen to this. Why hast thou lost the fresh blood in thy cheeks? So I hear some blood deficiencies there, which often from a TCM perspective, I see a lot with trauma. And given my treasures and my rights of thee to thick-eyed musing and cursed melancholy. So here we have one of the real devastating pieces that goes along with trauma, which is an interruption in the social bonding system and our ability to tolerate being close to others, our ability to engage in sexual connection in a way that's nourishing, friendship, and potentially having too many thoughts or sadness, depression. There are a lot of other ways that can show up that are not included in this text, but I think it's pretty good for a couple hundred years before PTSD was described. I think Shakespeare gets it pretty right. So I thought a lot about how I wanted to structure this presentation, and I really came down to thinking that, if I can be very honest and like just share my heart with you, I am not the world's most brilliant herbalist. I'm fairly new in my practice. I've been doing this work for about 3 years as an herbalist and about 10 years as a body worker, and then herbalist and body worker. I'm not a psychologist or a psychotherapist. I don't practice counseling or psychotherapy. I don't have any huge, credentials and biochemistry or some of the cutting edge medicine making work that I know some of the people in our herbal community are doing. And so I thought a little bit, what is it that I can really teach and contribute to an audience of people who, many of you are very, very experienced in doing trauma work from either an herbal perspective or as another kind of clinician, like somebody mentioned in the beginning before we started. And in my reflection, I came to this, that whatever my deficits might be as an herbalist or in other areas, what I really know is how to sit with trauma, fear, and the really devastating manifestations of chronic traumatic injury. And what I want to impart more than anything is the feeling, the aesthetic of how to be with people and how to be with yourself as you're working into this area. And to give some highlights and some pointers toward the ways that the plants can support and help us in this work. But there's no way in an hour and a half that I can comprehensively talk about all the plants. But what I know I can do is give my best to impart the aesthetic, the feeling of how to do this work and how to be with people and how to use some of what has developed in our understanding of trauma to do a better job, not only of being with people, but of matching the people and the plants to one another in a way that is supportive. So that's going to be my focus. It's not going to be a comprehensive survey of materia medica for trauma. But I hope that we're going to start sort of pointing in the right direction, and then we'll talk about some resources and some other places to go. So fundamentally, if I think of what the opposite, there are sort of two things that I think of as the opposite of trauma. One of them is aesthetics, beauty, life, the feeling of being alive. So aesthetics, a lot of times seems like an academic word or something. It really just means like the feeling of things as they're communicated. And I think that there is a really important place that herbal medicine has to play in bringing forward kind of an aesthetic response to trauma. And I think about it like this. Aesthetics are the opposite of anesthetics. And the nature of the traumatic response has a lot to do with the body's protective mechanisms that shut down feeling in order to cope with the perception of life threat, that imminent death is about to happen. And healing trauma in some ways is about unfreezing the body. It is about coming out of that petrified state, out of a state of immobilized fear, and into a state in which feeling and connection are possible. So my hope is that, as much as I want to share some very fact-heavy information, that we can stay in this feeling place and that we can really be in our hearts more than our heads during this call, and then any time that we're working with people who are recovering from trauma. And I want to say just a tiny bit about my story and kind of how I possibly am here teaching this webinar today. Um, just to give you a little bit of a sense of how to evaluate the information, anytime that you learn from someone, it's really important to ask, who is that person? What is their belief system, and why are they teaching what they're teaching? So I want to make that really transparent, so that you can, filter the information as you like. So I grew up in a very stable home with a mother and father who are absolutely still in love, and very kind of idyllic upper middle class childhood. And in my young adolescence, I started to have a significant physical and emotional illness emerge. And the physical stuff I never connected at all to traumatic response. It didn't even occur to me that that was a possibility. I had first polycystic ovarian syndrome, barely a year after I started menstruating. I was diagnosed with that. And then partway into high school, I had an autoimmune illness called idiopathic thrombocytopenia purpura, which is a mouthful, but it is a bleeding disorder that is autoimmune in nature. So the body's immune system attacks the platelet cells, and it looks a lot like hemophilia in terms of the symptoms. Like somebody can touch you and you get a huge bruise, and there's a real risk of like
Muted. Unmuted.
Are you all able to hear me? Okay. Um, I'm hoping that everything's okay. Paula, I'm going to turn on my phone so that if there are any problems, you can text me and let me know. So, sorry, I'm paranoid. I want to check. Okay, looks like that is working. Okay, sorry, everybody. I heard it say muted and unmuted, and I was really worried. Okay, so I had ITP, this bleeding disorder, and then a few years after that resolved, I started to have really a lot of psychological symptoms, really intense mood dysregulation, mood swings. I was self-injuring. I had a lot of suicidal thoughts. The first time actually that I started having suicidal thoughts, I was in 5th grade. And then, many years of, suicide attempts and sort of in and out of the hospital and lots of practitioners and wondering like, what is wrong with me? And at that time, I really felt very convinced that, it's so weird. Like, it seems like the way that I'm, these symptoms, like, it's as if something really terrible happened to me when I was a kid, and nothing terrible happened to me. Like, I had no memory of that. I had, no sense that trauma was a part of my story. And it took many years and a serious bout of ulcerative colitis and an amazing life as an actress and working in the theater, which was incredibly healing for me. Some really good psychotherapy, um, and then ultimately the work that I've been doing with herbs and with other people, to come to a point where I could see that in fact trauma of a very different kind than I knew to expect or to look for was definitely part of my story. And I have started to see that, in fact, I am not alone, and there are probably clients in your practice who have digestive illness or really out of whack, weird stress responses, or even psychological and emotional disturbances that they can't really explain or account for, and that don't respond terribly well to medication. I never responded very well to psychiatric medication. Um, and and that there might be actually a trauma piece there for them as well. So we'll talk about that. And I think my intuition about the fact that trauma was part of my story led me to try to learn a lot about it, and to feel a real kinship with people who were trauma survivors. So I did many years, 4 or 5 years of work as an online crisis response volunteer for RAIN, which focuses on sexual trauma. And I started to notice that in my bodywork practice as a massage therapist, I was working in a physical therapy clinic, and I started to accumulate all of the cases. Like, I had some clients who didn't fit this profile, but a lot of the clients who were sort of labeled a little difficult or a little slow to get better, or they weren't really fitting into the physical therapy paradigm of, like, your shoulder is broken and we're going to rehab it and you're moving on. They were people with fibromyalgia and chronic pain and kind of other assorted things that might be labeled psychosomatic. And I loved working with these people. And what I started to notice was that at a certain point, the body work was very useful, but at a certain point, I knew that we needed more. And that's really where the herbs have started to come in. So what I'm hoping is that this sort of combined experience of the personal healing, which I want to say to anyone here who is a survivor, and anyone who is a clinician survivor, which I think is probably more of us than not, the work that you do on yourself, the transformation of your own wounds, and the willingness to sit with them and be with them is one of the best sources of training that you're ever going to get, certainly more profound than anything I will give you today. It's not for nothing. Walking through that difficult passage does give you access to gifts that you can't find any other way. And it doesn't mean that the trauma itself is a gift. It is not. But there are gifts to be found if you are able to walk through that process. So I want to talk a little bit about just recognizing trauma and what are we talking about. First, of course, the word trauma also can mean physical traumatic injury. And often, but not always, the two things go together. So when we talk about trauma in a sort of psychological context, I think there's a real tendency that we have to go toward imagining that we're only talking about the kind of trauma that is dramatized on TV and in movies, which usually has to do with a single traumatic event, a rape, a witness of some kind of violence, something singular that happens in a moment in time, and then has the features of a traumatic response, which would include flashbacks, anxiety, mood dysregulation, hypervigilance and fear, these kinds of things. And some trauma does look like that. But a lot of kinds of manifestations of trauma look really, really different. And that's what I want to highlight a little bit. So the first thing to know is that trauma, the recipe for cooking up trauma, is dependent on a couple of different factors. And even more than the event itself, whether trauma develops has a lot to do with the being who experienced the event and the way that being responds to the event, both physically, which is not something that is a conscious choice, but something that the body does, and then also kind of how that person is able to receive support or care after the event, and whether or not they were immobilized or able to make an attempt to escape. There are a lot of different factors that go into whether or not a single event actually translates into trauma. So it is really inaccurate when we say about something like, oh, that event was so traumatic. The response was a traumatic response, if that makes sense. So I want us to really decouple the intensity of the event or the perceived intensity of the event from whether or not there is trauma. Partly because I want us to give validity to survivors who, maybe their trauma doesn't seem like as severe as trauma that you've experienced or something of that nature. It is really not about the intensity of the event itself. It's a dynamic combination of the event and the person. And then the other thing to really highlight is that there is another kind of trauma that is only beginning to be more widely talked about, called either complex or developmental trauma. And this is more of the kind of trauma that I experienced. And it has to do with the nature of the relationships that are around a child as they develop emotionally and physically. And complex trauma is not a single event. It's not, one time that something really terrible happened to you. It is a series of it's a series of events, and more than that, it is often based on ways of relating that develop between a child and its immediate caregivers. I don't want to go too deep into it, but what I will say is that oftentimes, sometimes complex trauma is like from very explicit and ongoing long-term abuse or neglect. And those folks usually know that there's a childhood trauma involved. And sometimes, like in my case, complex trauma happens within families that are very loving and very healthy in many ways, but because of an emotional injury or a more explicit trauma or neglect that a parent experienced, which is true in my story, that parent is then unable to be available to the child in a certain way emotionally, and it creates a serious divergence in the way that the child's nervous system learns to regulate itself. So that kind of trauma, whether it's sort of hard to see, like the kind that I experienced, or it's really easy to see, like in an explicit abuse or neglect, that is the most difficult kind for people to recover from, because essentially recovery means needing to go through a process of relearning how to do this kind of emotional co-regulation with other humans in a way that you didn't learn how to do or didn't get to do as a baby or as a young child. In cases like that, if you are not a psychotherapist, you have got to get you've got to get a psychotherapist on board in order to serve your clients the best. That is something that, as an herbal practitioner, you cannot do. It's not within our scope of practice, but it's important to know that it's there. So actually, before I do this, I want to do something else. So, sorry, I pulled my headphone out. So there are a couple of things that that can help you to kind of recognize when trauma is present. Over time, and particularly if you have experienced trauma yourself, a lot of times this will come in as a feeling sense before you can explicitly recognize or name the symptoms or the things that you're noticing. But here are some of the things that you can just look for or be aware of. So the first thing is to look for flat affect. So this would be somebody's facial expressions being very blank. It can also that can also be a sign of depression. It can also be a sign of autism. There are other things, but want to just kind of give you the picture. Another sign is lack of prosody in the voice. So I want to just sort of do this for you. Part of why I wanted to have my face and my voice working together is because I want to give you a picture of this. So notice how you're feeling just now, especially if you're watching my face on the webcam. And then I want you to notice what happens inside when I switch into this other mode of speaking. So if I start talking like this, and I'm not moving my face, and I don't have any intonation, prosody change in my voice. Notice how that makes you feel inside. And to the extent that you're feeling anything, just the prosody came back in. To the extent that you're feeling anything, it is because your brain has, I have to come out of it or I'm not going to feel good. Your brain has a system of, they're called mirror neurons that actually recreate for you inside your own brain and body what it would feel like to be the person that you're watching or that you're listening to. So the experience of empathy is brain-based and embodied. And if you feel that kind of shift when you see somebody whose face is flat like that and their voice is flatlining, it's your body picking up that something isn't quite right, and a little bit of the feeling of shutdown or even fear that the other person might be experiencing. Okay, so that's the face and the voice. Another thing to look for in kind of herbal settings is the clients who have a lot of kind of seemingly very disparate symptoms, have been to many practitioners, have tried everything physical that there is to try, every elimination diet that you can do, they've tried everything and have gotten no relief. Not always, but often there is a there's a trauma component to what's going on. And we're going to talk about why some of the symptoms can be so varied and why these physical manifestations are so prevalent. Another key is digestive disorders, especially irritable bowel syndrome. Has a very, very high correlation. Certainly not everyone with IBS, but many people with IBS have a history of childhood or developmental trauma of some kind. Another thing to look for is tight musculature. People who are seemingly like tightly wound, really tight muscles of the head and neck. A lot of times there will be a lot of headaches coming from the tightness of the muscles. All of these are some things to look for. And in an herbal setting, it is appropriate to ask your clients if they have any trauma history. My policy is to really not inquire about the story, about the what happened. It's not relevant for me as an herbalist, and it is potentially something that could be re-traumatizing or triggering for the person. So you don't need to ask what happened, but you can ask, do you have a history of trauma of any kind? And just remember that sometimes, like I would, if I were your client at a certain point in my own journey, you would have asked me that question and I would have said no. So in my studies with Michael Tierra and the East West School, we always emphasize treat what you see. And so you don't have to give anybody a label that they don't want. You're not diagnosing anyone, but if the shoe fits, work with some of these tools that are related to trauma if you're seeing these kinds of patterns. Again, no need to suggest to someone that they have experienced trauma, no need to diagnose it, no need to make it explicit. Definitely a good thing to refer to a good psychotherapist when you can, but you don't have to dig into any of this stuff. In fact, I think it's better not to. Okay. So I want to talk about a couple of highlights of the physical things that change in our bodies when there is a traumatic response. This is an awful lot of information that I could go into, and I am not a physiologist. So what I'm going to do is focus on the highlights of the things that I think are most important to understand. Please don't get hung up on this slide. I want you to really mostly listen to this as a story and take the information in that way. So the first thing that we have to do is update our understanding of how the nervous system works. And this research is now about 20 years old, and I highly recommend that you learn more directly from Dr. Stephen Porges, who is the researcher who really developed this theory. It's called the polyvagal theory. And it is the most correct model of how the nervous system actually works, the autonomic nervous system, that we want to replace that old notion of the sympathetic versus the parasympathetic nervous system, which you might have heard in school. So you might have been taught that there's the good parasympathetic nervous system, you know, the rest and digest, or the feed and breed part of the nervous system that helps us to feel good. It helps us to digest our food and bond with others, sleep well. And during that kind of a parasympathetic state, the body is able to repair and recover, right? So this is probably sounding familiar. And then the other half of that in this outdated model was the sympathetic branch of the autonomic nervous system, the part of the nervous system that was responsible for the fight or flight response, the active defense, right? And the sympathetic branch is associated with all of the problems of, you know, chronic stress, and, you know, all of the sort of stress-related illness was all sort of an overly sympathetic nervous system dominant state. The problem with that nice little theory is that it is not correct. The parasympathetic nervous system is more complex than this model suggests. And what you have to realize or take in is that as organisms evolved, the oldest defenses that we have against, you know, threat to our life have remained intact. And over top of those old defenses, we've added new ones. So the oldest defense is this more reptilian defense of like just becoming totally still and, you know, freezing in the face of life threat. And this is mediated by the parasympathetic nervous system, okay? Specifically, the vagus nerve. Even more specifically, the unmyelinated, so the not covered with insulating myelin, the unmyelinated dorsal, so toward the back, fibers of the vagus nerve. Now, the vagus nerve, the word vagus is related to the word vagrant, and it means wandering. So the vagus nerve is a cranial nerve, so it comes, you know, out of the brain, and not only does it have the old unmyelinated branch that goes down below the diaphragm, and that branch has a lot to do with the digestive illness and all of this kind of stuff that is part of the legacy of trauma for many people. So it has that old below the diaphragm branch, and then it has this other branch, which is the myelinated, the newer part, that goes to the heart, and then also to the muscles of the face, the muscles of the inner ear, the muscles of the throat. It has a lot to do with the swallowing reflex. All of these things that are very much part of our social engagement system with other beings. So I want to mention here a relationship between this dysregulation of this vagus nerve, not only for trauma survivors, but also for a number of other people who you might see in your practice. This is something that comes into play for anyone whose challenges include sensory processing issues. Often the case for trauma survivors, as well as people with autism spectrum and Asperger's. So Karen, this speaks directly to what you were talking about with your people with sensory stuff. So when the newer part of the vagus nerve is firing, you get kind of what you're seeing now with me. Like you get nice prosody in the voice, you get the ability to interact in a kind of healthy way with others. And then you also get a lot of that sort of what we used to think of as like parasympathetic state, right? So you get good digestion. You get the ability to be close with other humans, being close without fear. Being able to immobilize without fear is a really important part of human life, for our sexuality to be able to be sort of, not immobile, hopefully, but, relatively close and still with another person and not to feel afraid. All of these things are important for caregiving, rest, sexuality, all of this. And when that part of the vagus is going, we also get nice measures of heart rate variability. We have a good, ability to breathe and feel good, and we feel like ourselves. We have access to all of the parts of our thinking and feeling apparatuses that make us feel human and make us feel like us. Now, when the dorsal vagal branch is activated, this is also parasympathetic. It is a totally different scenario, okay? So this is the oldest and most basic defense that our body has in moments when the body itself perceives a threat to life. So it's not a conscious thing. It's not a mental perception. The word that Dr. Porges uses is neuroception. So it's like your nervous system noticing something, maybe with or without your conscious mind agreeing. And when your nervous system feels or sees or senses that you are in immediate danger that could end your life, this old defense, this old dorsal vagal response turns on, and it turns off all of this part, social engagement piece. It dramatically lowers your heart rate. So opposite of what you expect with fight or flight or a sympathetic response, right? Heart rate drops. So we have bradycardia instead of tachycardia. It's possible that urination and or defecation could happen. Again, we've got that branch of the vagus that is below the diaphragm controlling those things, and immobilization. So this is exactly what's happening to a deer in the headlights, okay? The deer is having a dorsal vagal response, and it is not adaptive in the situation where the car is coming. Similarly, sometimes this response is adaptive for humans and sometimes it isn't. And more than that, because we don't have a wide cultural understanding about this freeze defense, the misunderstanding about this is a lot of what has gone on with the legacy of blaming survivors of violent crimes for not fighting back or perhaps not saying no verbally. A lot of times you don't have access to language in this freeze state. There isn't really any thinking. It feels like being blank. It feels like not even being there. We'll talk a little more about what this looks like when it's not in the immediate moment of being triggered. So what can happen with people who experience trauma is that it's not like the animal in the wild who goes into that freeze state and then is able to survive and shake it off and kind of move forward because of many other complexities that have to do with human life. Sometimes once this shutdown has happened, and particularly when there's complex trauma, and this was going on as a primary defense for young people as they're babies and young children, shutting down, it becomes it becomes all the more likely for the nervous system to go into this state of shutdown when any amount of threat is perceived. And this has really devastating consequences for survivors, because when you're in a freeze state, all of the parts of your nervous system that allow you to interact with others and to co-regulate your emotional experience with other human beings, we're social animals, all of that goes offline. And this, I think, is fundamentally a big part of why people who aren't well informed can experience clients and patients who are trauma survivors as difficult, because they are not able to give you the same cues with their voice and with their face and even their thinking. They're not able to engage with you in a way that feels good and rewarding all the time. And with that, if we don't understand that, it's easy to blame the person or to think that they attribute things to them that are not there, like, oh, they don't like me, or they're mad, or they're like whatever. It's very easy to project onto them. So instead of doing that, when we see people that are in this state, I want you to understand that it is coming from a body level decision that there is not safety, and we need to establish safety first. And then we need to help people to recognize when they're going into this state, what it feels like in their bodies when they're going into this state, and then give them, in our case, give them some herbal remedies and options to help bring the body out of it, to help kind of bring feeling back in, bring us back to life, right? So the aesthetic response to this sort of anesthetic shutting down. Okay, just mentioning a couple of other things that are important to know. It's cortisol, of course. I'm sure that you all are familiar with the stress hormone cortisol and all of the many ways that cortisol is very important for our life, and that cortisol can be damaging when it is present in excessive amounts. One thing that is really important to know is that all of the negative effects of cortisol that we're aware of are mitigated by movement and exercise. So when this is my theory, hypothesis, when somebody's response to a traumatic event or a really scary, potentially life-threatening event is a sympathetic response, and they're able to run away or fight, there is a lot less of a chance that there's going to be a traumatic aftermath for that person, because number one, the body was immobilized and it was able to successfully move off or avoid this threat. And then the cortisol, it plays a role in sort of changing the way that memory is stored and many, many things. The cortisol is metabolized during the course of that activity. So if you can get your people, if they have a sort of a traumatic history, or they have kind of emotional upset that leads them to get really active and sympathetic, if you can get them to exercise or move in order to regulate that, you can pretty much eliminate all of the really, really difficult and tough side effects of this kind of situation. It's very different for people who go into the freeze. But that, I think, is really important to know. Cortisol does not have to be a big, bad boogeyman if we can get movement into people's lives. And then the other thing to look at with trauma survivors is the hypothalamus pituitary adrenal axis. And this has to do with the way that the brain and the body regulate all of the many systems of the hormones that control everything from sort of sleeping and waking all the way down to, reproductive hormones, metabolic hormones. That is something that is often disrupted in trauma survivors, partly because of sleep disturbances, and then also because of the flooding of the nervous system with stress hormones. So I really think that when we're looking at endocrine system stuff for trauma survivors, the first thing is about restoring sleep and restoring a sense of safety. We'll talk about the safety piece in a minute. Musculoskeletal system, you're going to want to help people learn how to relieve the kind of the chronic tension and immobility that is part of the traumatic response. So muscles to look at are the psoas, the deep hip flexor muscle, the diaphragm, the sternocleidomastoid, which is I sometimes call it the skinny actress muscle to my clients because it's the one that like kind of pops out in your neck. And then the facial muscles. So if we were doing a whole day on bodywork stuff, I could teach you stuff all about that. But those are some places to look. And you can really just, encourage people, like I did in the beginning of this session, to just move the muscles of their face. Try to wake them up and bring them back to life. It has an effect on your heart and on your good sort of myelinated vagus. And then, of course, you definitely want to look at the digestive system with people with trauma history. There is a very well-established correlation with irritable bowel syndrome in particular, and also inflammatory bowel disease. A lot of this has to do with the fact that when that sort of old unmyelinated vagus puts you into the freeze state, it has a major effect on gut motility. And there are more, there's more nervous system in your gut than there is in your brain. So there's a lot that we don't yet know about this. And yet, just by understanding the amount of nervous tissue that's there, we know that there is a really major way that this is integrated into the problem. Chronic constipation is also a pretty common manifestation. It may not be explicitly IBS, but definitely can be part of this. And that, of course, can have to do with just being in a freeze state or a sympathetic state, and never really getting into that sort of good myelinated vagus, happy parasympathetic kind of a state. Okay, so this is a picture of my dog, and this really is the heart of working with people who have experienced trauma and are recovering from trauma. This is the heart of your own recovery to the extent that you're working on this with yourself. Safety is everything. There is nothing more important than not only actually being safe, but the body, that, the neuroception, being able to perceive that, in fact, we are safe. And there are some things that you can do as a clinician in order to encourage this feeling of safety. Number one is just to simply think about it, and to maybe even ask the question. You might not use the word safety because sometimes even using that word can be a little like it freaks people out. But you can use the word comfortable. Is there anything that I can do to make you feel more comfortable? And then to be really attentive, the polyvagal theory teaches us that this social co-regulation system, like if my myelinated vagus is turned on and the prosody is here and my voice, and I am kind of looking at you and smiling and responding and being with you, that is a very deep cue to the other person's nervous system. So to me, this suggests do not do your sessions like typing notes in your computer while your client is sitting there near you. You need to be engaging with them through, face-to-face contact. If you are not working with them face-to-face, a lot of my practice is virtual. The bulk of my clients I meet with over Skype or by phone. It means being really clued in to your vocal intonation and to really connecting vocally. That can absolutely do it. You can teach people to hum or sing. Those things really help. And then to use breathing as well. Diaphragmatic breathing, you're going to get physical stimulation of the of the vagus nerve in the abdomen, and you're also going to help to move the body into a more positive, restful state. So definitely, pranayama, counted breathing, these tools are really, really good. If you don't know them, let me know. I can send you some resources after this. And then this, I think, is really important. Educating your clients about the nature of this freeze response, and helping them to also educate the people that they live with or the people that they're close to. A lot of times a freeze response, when it is not in the moment of the trauma itself, but it's kind of in the world of a flashback or a response to what's happening in a room that feels really unsafe, but is actually maybe doesn't seem that way to other nervous systems that are not hypervigilant. Clients will describe it like they feel blank. They might say, like, I seem like I'm depressed, but I don't really feel sad. They will have an extreme indecision. So they will not want to be outside, but they will not want to stay in the house. They don't want to eat, but they don't not want to eat. It is a state of nothing is okay, nothing will help, and there's no real thinking that's possible. And for partners, relatives, friends, people who care about the person, they don't understand what this is. So first of all, they're not going to get the facial and vocal cues that help them to know that they're connected. And then all the suggestions that they offer out of, trying to be supportive are not going to be able to be taken in by the person. And so what can happen is then the partner, friend, or relative gets very frustrated with the survivor and then gets angry at them. And then that becomes another thing to be afraid of. And in that moment, when actually the connection with another person would be profoundly healing, it actually can drive people further apart. So I like to share information about the polyvagal theory and about the freeze state in particular, and then about kind of this idea of just what will help things to be safer. And with my own partner, I instituted a rule of, if I'm kind of in that place, just, you can try 3 things. Like, ask me, like, try 3 questions. And if nothing seems to work, then just let it go, because, people who are partners and caregivers have to take care of themselves too. So, so that's kind of the piece here with safety. And I think that's everything I wanted to say about that. Okay, so let's talk a little bit more about the herbs. So where does the botanical intervention fit in? The first thing is, you can think about all of your materia medica that helps with the stress response, all of your nervines, all of your kind of calming, just lovely herbs, everything from your lavenders and your chamomiles all the way to your, your skullcap and your pulsatilla and your passion flower. All of these herbs are definitely very helpful. And it is really supportive for people to know that they have a remedy that they can take when they're feeling either, really anxious and activated, racing heart, sympathetic kind of fear, or when they're feeling this sort of shut down freeze piece. The herbs can also be really helpful in supporting digestive healing and waking up the digestive system when it is shut down. Also, really helpful for nourishing the person. Being in a state of trauma and chronic stress affects nourishment a couple of ways. Number one, people's nutritional status is usually low. They're usually have trouble regulating their intake of food. So either overeating or undereating, or maybe they're eating enough calories but not cooking for themselves, or eating sort of nutritionally diverse meals. So the nutritional status is one side, but then the other side is that the body itself may not be assimilating the food very well if the digestion is compromised. And then more than that, you're going to go through some of your mineral stores and also certain vitamins, the B vitamins, a lot faster if you are kind of moving through these extreme states of anxiety, fear, or being frozen. So another thing that the herbs can do, and that I think is a really excellent piece, and this is very accessible for some of you who are not in a position to give people things to take internally, is that you can engage the senses to stimulate the vagus nerve. So even if you're not taking anything internally, aromatherapy is a totally valid and very effective way of bringing in some other input into the system, and waking up that kind of positive side of the vagus. And this is also really helpful for people who are fearful of taking herbs. That can be something that comes up with trauma folks. They're afraid of having a reaction or a response to anything that they take. And you can very often work with aromatherapy with no problems. And then there are other ways of engaging the senses too. So the swallowing reflex uses that sort of positive side of the vagus. And so drinking tea, not only is the warmth comforting and the ritual of making the tea is comforting, but actually swallowing is a therapeutic activity. It's a physical therapy for the vagus. And then, of course, using specific remedies and formulae for the patient's presentation. So most of my clients, I don't have a really extensive trauma materia medica, because most of the way that I practice is very much custom formulation for the person who is in front of me. And the trauma is a consideration there, but mostly the consideration is how is the body actually manifesting wellness and dis-ease in this particular moment or phase of life. So none of this trauma stuff should override the rest of your consciousness about how you work as an herbalist. It goes along with it. It may inform it, but the heart of your practice is going to be pretty similar. So I want to talk through a case, but before I do that, I'm going to pause and actually see if there are any questions that I want to answer now before we go into this next piece. Okay. So, we have a lot of questions. Okay. All right. So, one major issue, Karen is saying, one major issue with sensory issues in kids is helping them to refocus. Yes. Move off the trauma and help them to relax, refocus, and move forward. Yes. It's a great comment. And yes. Okay, the sound was lost for a little while. I'm sorry, you guys. Thank you for being patient with me here while I get through your questions. And go ahead and type in any if you have anything that you want to check in with now before we move on. Lisa says, I've been looking at research on medical trauma. Some medical practitioners don't believe it can happen to patients. Seems like a very much overlooked experience. Yes, this is absolutely true, Lisa. I'm so glad that you mentioned this. And very often, I think that this is very common. And in fact, I had a case last year of a woman who, again, she has this presentation, and I have the sense of this is a trauma person, and I feel it, but I'm not getting, she's not reporting any trauma history. And she was having terrible insomnia. If you're a Chinese medicine practitioner, she's, super yin deficient, very, very slender, um, very thin hair, highly anxious, like she's like a raw nerve, and very sensitive, very empathic and sweet, sweet disposition. She had the insomnia was a primary complaint. She also had digestive issues, and she also had skin issues and kind of like multiple self-reported like multiple food allergies and challenges finding the right diet for her. And after about 2 months of working together and making some very slow progress, very little progress with the sleep piece, she disclosed to me that she had a dental procedure as a child, and she was immobilized, but she was conscious, and she was unable to escape. And it was absolutely her trauma. I'm convinced came from this series of dental procedures, and this the feature of what puts people into the freeze state is when they are not able to escape or get away. And absolutely, medical trauma is a very real thing, and definitely something that we want to take. Okay. So Jennifer is asking, since we don't have a scope of practice to be psychotherapists, what do you do when you ask the question of a trauma history if they start to tell you their story? How do you handle that? I think it's a really good question. So my sense is that you do not need a license in order to listen compassionately to another human being's story and to their life experience. What differentiates compassionate listening from psychotherapy is that psychotherapy is an attempt to correct something about the way that the person's mind is working, or about the way that their kind of emotional development has taken place. When I am listening to a patient or client tell me their story, I'm not trying to fix them or change them. What I'm doing is I'm witnessing and I'm offering them compassion. And if we get to a place where you need a license for that, I think we're going to be in a really sad state indeed, because compassionate listening to each other's stories is one of the most fundamental things about being human. So it is really okay. In fact, I think it is really good to remember that fundamentally, when you're sitting with a client as an herbalist, you are sitting with another human being as another human being, and that the roles are there and they're important, but that your compassion and your love can be present and don't have to be bounded by any fear that if they tell you their story, you're doing something wrong, because you're not. What you want to do is listen respectfully, and avoid asking probing questions or asking for details that are not relevant to the work that you're doing. So sometimes it is relevant to know, for example, how old were you when this first started? Or how many years, were you in a situation that was traumatic, for example. It's not relevant to know the details of what exactly happened to someone a lot of the time, unless we're talking about physical consequences of the trauma that are directly relevant to your treatment. And it is always a good idea to ask permission, or to sort of signpost that you're going to ask a question that might be a little difficult before you ask, and to remind people, especially trauma survivors, that they do not have to answer a question that they're not comfortable answering. It can be really important to do that. I hope that's helpful. And then, of course, if you are feeling uncomfortable, I've been doing this work with kind of mental health for a long time, and so I feel pretty comfortable when people disclose. I feel also very comfortable referring to psychotherapists. And depending on where you are in the country and the patient population you're working with, like a referral to a psychotherapist can sometimes feel very dismissing to a person. So it is something to handle a little delicately sometimes. So if someone discloses their story and you feel out of your depth, or you feel like you're not in your scope, or you feel concerned about it, The remedy is to be truthful and to say, I'm so honored that you shared with me your story and what happened to you. And I am here for you and I'm here to help as best I can. And what I can do is offer you herbal support or dietary support, or whatever it is that you do that's in your scope. I can offer you this, and I am 100% thrilled to be on your team and happy to offer that part. And this story that you told me is really hard, and I can't help but feel like I want you to have more resources from somebody who has more training than I have to help you with this. And I have a couple of names of people who are really great, who I would trust as a starting point if you wanted to talk to someone else. And I would really highly recommend that you do that. So you can steal that language or something similar to that. And you can also require, there are cases where there are cases that I wouldn't take if I didn't know there was a psychotherapist on the team. And it's okay to be clear about that with your people. Truth is always a good path. Okay. Susan was asking, how do you initiate this line of observation with your client? What do you say? I'm sorry, I'm not clear on exactly what that was. Lisa's saying Hashimoto's and PTSD. Yeah, it can. A lot of autoimmune illnesses, absolutely, there's a strong connection with trauma history because of the immune system. I didn't put on that slide, but the immune system is absolutely affected by trauma and complex trauma in particular. So there is a connection there, and starting to work with the circadian rhythm is often the first place that I go if there is endocrine disruption or immune disruption along with trauma history. So I really look at circadian rhythm as a good place to start. Alana's saying, best herbs to wake up digestion. We'll get there in a second. If I had to pick three off the top of my head in this context, the first one would be chamomile, matricaria, because you have a really nice, calming, relaxing plant that also works as a digestive bitter, especially if you can get your person to take it in like a concentrated dose. So I like chamomile for this population a lot. And then depending on whether your person is sort of more hot or more cold natured, you could go directly for something like ginger, for example, or you could go directly for something like gentian, just a straight up, good old bitter, if the person is a little bit more hot natured. And if all of this stuff that I'm saying is totally over your head, hot and cold and all of this, learn more about the East-West School of Herbology and maybe, start to study with the school. It's a wonderful, wonderful place, and they'll give you all of that kind of theoretical framework. Yes, the recording will be available if all of the technology gods agree with us. Allah Shakti is asking about if I've read Bessel van der Kolk and how he aligns with polyvagal. Yes, that's a longer question. I would love to chat with you another time about this piece. Yeah, Bessel van der Kolk, Peter Levine, and Stephen Porges, they're sort of like my triumvirate. Okay. Lisa, this question about the commingled Hashimoto's and PTSD, let's do that in the Q&A time if we have time. Yes, this is a really good question also. Resources to educate herbalists about the traumas of racism, sexism, and LGBTQ traumas. So there are two kinds of trauma that I didn't mention up front, and I apologize for neglecting this. One kind of trauma is ancestral trauma, which I think is also plays a role in my story. It's more than I can go into now, but essentially, there is a legacy of traumas that happened in the past that have a bearing on how we function currently in the present moment. This is true for people, I think Most of us are the descendants of both oppressed and oppressor. The only way we're still around and have survived is that at some point, like our ancestors beat somebody else out for resources. And then there has just been such a very long history of oppression that I think everybody's family at some point has been on on both sides of this equation. And there are communities now who have comparative privilege and communities who live in significant oppression on multiple intersecting bases. I I think that it's beyond the scope of this piece to speak specifically to resources for these specific traumas. But what I do think is important is to speak truthfully about where your own ignorance lies as a clinician when you are working with somebody who identifies differently than you. And to, on the basis of just human compassion and love and listening, not to assume knowledge where you don't have knowledge. So what I would say is maybe we could talk together collectively about all of our best resources for this. I can't position myself as an expert. I do really love Theater of the Oppressed as a methodology. So maybe I could recommend Augusto Boal and Paulo Freire. Yes, it's important to let clients talk if they want to stop them from sharing can further the sense of shame about what they've been through. Yeah. Okay. Jennifer's saying, when we prescribe herbs for them based on the story, are we not prescribing treatment for it? Is it all in the nomenclature of how we're diagnosing in our scope of practice? Using TCM nomenclature would definitely suggest referral if necessary. Yeah. I, remember the trauma is not in the story or in the event. It's in the response, and it's multifactorial. And you absolutely, some of it, I'll be very honest with you, I think some of it is linguistics, and it's vital. There is a real scope of practice that's not just language. And then I think there's some amount of this that is, frankly, just language. But you are never treating the story. What you are doing is supporting the person so that they can physically recover and then hopefully emotionally and spiritually transmute the incredible suffering or trauma that they have undergone into wisdom and into a gift, into compassion for others, into empathy, into something useful and positive, or at the very least to be able to step into safety that they may not have had in the past and to experience real safety now. We're definitely not treating the story. Okay, all right, so let's continue on. I need to plug my computer in. Thank you all for these questions. This is really great. And we're going to dive back in. I'm going to talk about some specific herbs. I'm going to talk about this case, and I'm going to talk about some dietary pieces. I'm going to talk about a couple of my questions that I have that I hope as a community you will help me with. And then we'll do some more Q&A. And I'm happy to hang out a little longer than 4:30 for those of you who are able to stay a little bit longer. And if you can't, then hopefully the recording will be supportive for you. Okay, so this case, this is going to be the only case that I really talk about in deep detail. Thank you, Pam. She said my screen wasn't in presentation mode. I had to do that in order to be able to read the questions. So this particular client I first met maybe about 6 or 7 years ago as a bodywork client. And she had some anxiety at that time, and There were probably other issues going on that I wasn't aware of because we were engaging only on the level of body work. So I didn't need to know all of her health history in order to do that. And at some point, she did disclose to me that there was a significant trauma history that she was working with, and that she had a psychotherapist that she was working with. And it was not something that we then continued to talk about. But over the course of time, through that relationship, we built a lot of trust and fondness for one another. And so finally, many years later, so maybe about 2 years ago, she confided to me that she was experiencing a very, very high level of anxiety, and that the anxiety was interfering with her ability to be focused and productive at work. It was interfering with her sleep, and it was on a level where it was really getting in the way of activities of daily living. And so at that time, we had not explicitly started a sort of full herbal exploration, but I asked if she would be open or interested in working with any herbs in order to, relieve the anxiety, or as a first thing to try before considering pharmaceuticals. And she said yes, she would be. And at that time, in the interest of keeping things really simple, I gave her a combined, just a two herb formula that I like to use very, very often, sort of in one of a couple of configurations. So I gave her a combination of Lobelia inflata and passion flower, Passiflora incarnata. And I instructed her, as I often do with clients who are sensitive or sometimes have trauma history, to try both of these herbs separately in a very small dose, notice the effect, and then once she felt comfortable with each of them and was not afraid that they were causing any side effects, then to combine them together in the proper dose. So I gave her a starting dose of 1 drop for the Lobelia, and 5 drops for passion flower. Super low dose, not a therapeutic dose as far as I'm concerned. And that went okay. And then we increased the dose to about 7 drops of Lobelia inflata and about 10 drops of Passiflora. And then she would modulate that dose up or down depending on the severity of the anxiety. And the presentation of the anxiety was very focused in the chest, a lot of chest tightness, which is part of why the signature of the Lobelia for me. And then also it really had there was something very exhausting about it, and it was more likely to come up when she was tired, which is one of the signatures that I use for Passiflora. It is also very, very sedating, Passiflora, and so I like it for people with anxiety that disturbs sleep. So we had pretty decent success with that simple little intervention, enough so that a year later, when she was experiencing really severe irritable bowel syndrome, she was interested in then having a full herbal consultation. And so we did a full consultation at that time, and she had a great gastroenterologist who had put her on a FODMAP diet, and she was adhering really well to that, and had tested all of the FODMAPs. I mean, this client is so compliant. She's like a dream in that way. She did the whole FODMAP testing and all of that stuff, figured out what her triggers were, had gotten some improvement, but was still really still having like diarrhea, abdominal pain and cramping for days and days sometimes, and then alternating with periods of constipation and being unable to pass stool. And then with the history of the constipation, she had developed some prolapsing hemorrhoids that were sometimes just bleeding and a little painful as she passed stool, but then other times would fully prolapse and come out of her rectum, very, very painful and difficult, and to have to physically put them back in and all this kind of stuff. It was really, really a tough situation for her. And despite she had really done a lot to try to manage her stress, she's still seeing the psychotherapist. The gastroenterologist was like, knocking it out of the park with the dietary stuff. And we were still having these problems. And the first thing that I did, I did a complete TCM focused assessment on her. And the pattern that emerged very clearly was a liver attacking spleen pattern. So for those of you who aren't TCM people, you can kind of tune this out and maybe sign up to learn from Michael and Leslie. And so we did a modification of a formula that I'm going to struggle to pronounce the name of, but I'll include it in the notes for you. That is a classical formula for painful diarrhea. And modified that formula with a couple of more sort of heart, spirit focused herbs. So I really often like to use langu and muli, so dragon bone and oyster shell to help sort of settle the spirit. Added swanzao ren, ziziphus to this formula for her, again, sort of nourishing the heart and the blood and calming some of this background stress while working with that primary pattern. And we had really quick, great results with that. And then I also encouraged her to continue using the anxiety herbs that we had initiated some time ago. Whenever she felt a little bit stressed, even if it wasn't a super strong anxiety situation, to use a little bit of the lobelia particularly. I don't know if this is true, but I have a theory that lobelia's effect of, having this, we have this perception that lobelia can go right to the place in the body where the issue is. I have a little hunch that maybe this has something to do with lobelia having activity specifically on the vagus nerve. And so I like to test lobelia a lot with my clients who have trauma history, and particularly this sort of freeze shutdown response. And she had both. She had both sort of an excessively sympathetic response and anxiety, as well as the shutdown freeze piece. So we got the IBS mostly under control. And then the next thing that emerged, she told me that she was having, in addition to still having some trouble with the prolapsing hemorrhoids, she was having this, well, actually what she said was, I'm having chronic yeast infections and nothing that I do will fix them. And so whenever a client says something like that to you and they have seemed to self-diagnose, do not take it at face value that what they are having is a yeast infection. This case really helped me to learn that lesson. So I started asking her, well, what are your symptoms? And she didn't have any vaginal discharge or odor. But what she had was a stinging, itching, and burning feeling in the vagina, and also this kind of, she had a similar kind of burning, itching discomfort in her rectum that she connected to the hemorrhoids. And she had told me that her gynecologist had suggested that she might go on antidepressants in order to help with this symptom. And the symptom was bad enough. It was made worse by menstruation. It was made worse by sexual intercourse. It was made worse by constipation, because then that was getting the hemorrhoids upset. And she really was like trying all of these sort of probiotic type remedies and over-the-counter yeast infection stuff. And none of that was helping. So I decided to test whether or not this was actually a nervous system activation, whether this is just irritated nerves and that the sensation she's having is not at all yeast infection, but is kind of upset and overly sensitized nerves. And so we started using St. John's wort, both topically. So I was having her apply St. John's wort oil topically around her rectum and vagina, and then also having her use St. John's wort tincture internally in addition to the formula that she was using before. And taking a dropper full of St. John's wort every hour while she's experiencing the burning, itching, the sensation. And within 2 days, she had significant relief. And then we were able to sort of slowly drop down that dose of the St. John's wort. And for a while, then she was using it only topically. And now if something happens and she kind of gets irritated, she will go back to using it orally, but is not on it all the time. So the reason that I wanted to share this case is because this is what it really looks like when you're an herbalist and you're working with trauma survivors. This case could easily have fit in a lecture or a talk about IBS or about vulvodynia. It is not necessarily immediately apparent that there's a trauma connection, but if it were not for my ability to establish a feeling of safety, I would never have been able to do any of this other herbal work with this client. Because without the understanding of the background, that the way that trauma affects people's ability to relate, and knowing a little bit of sort of that aesthetic approach of like how to make it feel safe for someone as best you can, we just won't be able to reach people who have these histories. And once you are working with them, at least as far as my knowledge takes me right now, there's no big fancy different thing to do with the herbal interventions themselves. The thing that is different is how it feels to be together, and what you need to do as a practitioner in moments when the person you're working with might be feeling afraid for reasons that may not at all be apparent to you. And how to bring back that ground of safety so that you can do productive work together, and so that you can treat what you see, as we talk about. And this, I wrote here, it's not always necessary to talk about the trauma. That could say it's not ever necessary to talk about the trauma. That's a little strong. Some people do need to talk about it, and they might need to talk about it with you, even if you're not a counselor or psychotherapist. But a big part of the art of being a healer, I was talking about this with my wonderful colleague Christy Shapla yesterday, talking about a Lonnie Jarrett lecture that we had listened to, that I'll send to everybody in a follow-up email. That really what we need to do as providers and practitioners and friends for one another is to believe in the wholeness and the wellness of the other person fiercely and devotedly, even as we acknowledge and soothe and work with the pieces that are wounded and broken and not functioning. So we don't have to get hung up on or talk a lot about the explicit story of the trauma itself in order to do really great work with people. So I want to do a couple of thoughts about dietary support. When I hear case reports, or sort of when I hear things from other practitioners, the thing that freaks me out the most when I think about my trauma people is the way that some of us are intervening with food, because what's good for one person isn't always good for another. And there are some specific things that are important to think about for trauma survivors with food. So I want to go over this piece. Um, the first thing is that before we get into kind of a materialist perspective on which foods and what balance of foods are best to nourish someone, and like what's toxic and allergenic and like what should they not eat, um, before you ever get there with someone who is recovering from trauma, the first thing we need to do is establish some safety and some structure around food and eating. So the regulation of food intake is the priority, not the specific foods themselves that they're eating. It's very foreign for a lot of us who practice natural medicine. It is not how we are taught. But if you don't feel safe, you're not going to be able to eat very well. And if you're not eating well or regularly, your body will not feel safe. So I really encourage learning a little bit about the eating competence model developed by a dietitian, Ellen Satter, in order to familiarize yourself with this kind of way of thinking about nutritional adequacy and food. So mainly, there's just a lot of don'ts around people who are not feeling safe. Like, do not, please, please, do not make them afraid of gluten or dairy or whatever, meat or anything. That is not the first place to start. We're going to try to establish safety first. So then the next thing is, once we have some structure, so once we're eating a couple times a day at regular times, offering food to ourselves, and like that's going okay, then you can start to focus on adding foods that are going to be more nutrient dense. So this can be a slow process too, but it really is like a focus on adding that I think is most helpful next. Another point is that I feel very, very strongly about this. Adequate complex carbohydrate intake is necessary for emotional regulation. So please help anyone who is recovering from trauma and is not doing fabulously. If they're doing fabulously, then I'm happy to be proven wrong. If they're not doing fabulously, please get them away from any ultra low or low carbohydrate diets that they might be following. It is very, very hard for this kind of emotional regulation and this optimal vagal tone to happen, it seems to me, when people are not eating enough complex carbohydrates. Once you get to a place where you can really start looking at food a little more, be aware that B vitamins, magnesium, and mineral stores are often going to be depleted in these folks. So herbally, this is a great place for those, nourishing herbal infusions that we all love. This is a great place for your nettles or your red clover or, just whatever is appropriate to that person, whatever they like and will tolerate. This is a great place to use herbs to help restore minerals. And then magnesium as well. Do it through food, do it through transdermal absorption, but that can be a huge help for people with anxiety, tachycardia, all of this kind of stuff. Magnesium is definitely a key. So in my opinion, this is not the time for elimination diets, difficult dietary changes, etc., unless there is a very clear and dire need to eliminate a specific allergen. I don't want to go too deep into that, but that's my opinion. And then another little kind of hint is that warm, soupy, thick foods are often really comforting for people who have some amount of a freeze state going on, because instead of being a lot of chewing, there's more of a sucking and swallowing kind of a thing of actions going on. And this does turn on that myelinated vagus. So I think this is a big part of why people, like dip into the ice cream. They're sucking and swallowing something off of a spoon, and it's very comforting. Feeding behavior is one of the ways that newborn babies regulate this vagal response. There's a lot of research on that. So when people are out of balance with food, a lot of times it's not just that they're emotional eating, like they're regulating their nervous system by eating. So this can be helpful to know how to, have some recipes available for people that are sort of thick, soupy, healthy stuff like that they can that will work aesthetically with what they need. Okay, TCM patterns. I am going to not go through this right now because I know that we're running a little bit low on time. I'm just going to leave this slide here for those of you who are TCM practitioners. This is what I tend to see. I used to think, before I really saw a lot of people with trauma, that I was going to see tons and tons of kidney stuff with trauma survivors, and I haven't. That hasn't been what I have seen. I tend to see a lot of heart and liver blood deficiency, spleen, qi and yang deficiency, and heart yin deficiency mostly. And then lastly, this is kind of a cool tool. I think there is a very strong correlation between complex trauma and what we call a heart-stomach crack in TCM tongue diagnosis. So a heart-stomach crack is a vertical crack that runs down the very center of the tongue toward the tip. And very often, this is present in people who experienced a lot of stress in childhood and then have kind of a pattern of internalizing the stress of other people, a lot of times with kind of digestive issues going right along with that. Sometimes it's a challenge with weight regulation, but a lot of the time it is IBS manifestations. So it's just kind of a cool thing to know about if you're doing tongue analysis. So I do want to talk about a couple of sort of standout remedies. I really stand by the feeling that I don't have a whole different set of herbs that I use with people who are recovering from trauma, though these are sort of a couple that I think of as there's something specific I would say about it with relationship to trauma survivors. So the first one is Lobelia inflata, which I know there are some people who are scared of this plant, but this is really one of my very best allies, and I have never had a client have a problem with it. I do instruct people very clearly about how to take it, and I think that's probably part of the success. Lobelia is a parasympathomimetic. It's considered a parasympathomimetic. And I have a hunch that there is a dose-dependent way that it affects the vagus nerve kind of differently depending on how much you take. And so at a low dose, what I am finding is that even though it is, people perceive it as quote unquote relaxing, I think that it is actually helping to stimulate those kind of inhibitory fibers of the vagus that it helps to actually bring people out of a freeze. I have no scientific way of backing that up, but that is what I have. That is what I have seen. And to do that, I use it in kind of a moderate dose. So, for a 150-pound adult, I would use probably about 5 to 10 drops, depending on that person's sensitivity, and then with the possibility of increasing that dose up to 15 to 20 drops after the person has tested it and found that they don't get relief from the lower dose. So I would love to hear from other members of the herbal community, like what your experience is with lobelia. And certainly if you have any ability to do research about this sort of question or other experiences with people in a freeze state with lobelia or any other plant, I would love to hear. Suanzhao Rentong is the Ziziphus preparation. And this, I often use this with people who are kind of on that deficient side. It's a heart, liver, blood deficiency formula. And this is a really great support for sleep disturbances relating to traumatic memories or trauma issues. And I've had really great results with it. It's very well tolerated. It is not the thing to use for somebody who is really kind of excessive in constitution, so somebody who's like really like big and there's a lot of stagnation or a lot of like phlegm kind of symptoms. This isn't the right thing for them. But for people who are more on the deficient side, this is a great way to go. Schisandra and the adaptogens in general, I think, are hugely important for people recovering from trauma. We want to help bring all of the body systems back into a state of kind of normal balance. And the adaptogens, of course, are like they're magical in that way. And Schisandra I like in particular because kind of the inherent balance of this plant. And it is, I find, both kind of very, very nourishing for the people who are kind of the deficient folks. And it's also something that works for people who are a little bit more on the excess side. And we don't have to worry about, for example, the person who's asking about Hashimoto's. Certainly I also like to use ashwagandha a lot with trauma survivors for whom it's indicated. But you have to be careful there because if anyone's ever been slightly hyperthyroid, ashwagandha, there have been a few cases of it triggering a thyroid storm. So you only want to give ashwagandha if people have never been hyperthyroid. And Schisandra, like ashwagandha, Schisandra it's not super stimulating the way that, your ginsengs can be. And it doesn't interfere with sleep. I do usually dose Schisandra in the morning, not at night. But it's a really good option that I use very often. Hypericum perforatum, St. John's wort. You heard me talk about it in the case, and I think that that's a really perfect illustration of the way that I think about Hypericum for trauma survivors. I don't tend to think of this as, the antidepressant herb. I tend to think of it as the nerve restorative, soothing herb. And I think of it as, when it seems to me like someone's nervous system is turned on, or it's like, wired into something that's like an electric shock and it's just frying. I tend to think of St. John's wort as a possible support. When there is chronic pain, especially nerve pain, I almost always use this unless there's a strong, drug interaction or contraindication to not use it. And the kind of situation that the client, the case that I described, was having, that sort of burning, maybe even itchy presentation is a great indication to give this plant a try. I mentioned earlier when we were talking about herbs to turn on the digestive tract, chamomile, and this, I think, is a really great example of, herbs are multitaskers and they have multiple applications for different body systems. And sometimes it depends on the dose. and the delivery mechanism of, how it's going to hit the body. Chamomile, especially in slightly higher doses and concentrations, is a really effective digestive bitter, and it is also nice, calming, nerving, and very helpful for anxiety, sleep, and all of that kind of stuff. If you can get your people to take it when it's kind of tasting a little more bitter, so get them to brew, 2 tea bags in their teacup instead of just one, then that's going to work even better. But if all you can get them to do is to take that light little sort of recreational tea, then by all means, do what you can. I think it will still be helpful. And when you're dosing digestive bitters, of course, I think a lot of folks know, but I think we have some newer practitioners with us. You want to do that before the meal so that it turns on the digestive functions. So, encouraging some sort of stable rituals in people's lives is a really good way to help establish that safety. So if you can get somebody having a ritual of a cup of chamomile tea 10 minutes before dinner, that's going to be really helpful, not only physiologically, but also as a ritual that's supporting them in feeling safe. And then don't write off aromatherapy and recreational doses of gentle teas like your lavender, your chamomile, these sort of, pleasant teas that are not necessarily therapeutic doses. From an aromatherapy standpoint, I really like Melissa officinalis, lemon balm, and also neroli, orange blossom. Depending on whether the person needs a little bit more lift and stimulation, so in a freeze state, I might go for that Melissa. Or if the person needs a little bit more calming, also with depression, neroli is really helpful. Again, using the senses, waking up the senses is very, very helpful here. And then, we could do a whole session on aromatherapy. So I hope someone who is an aromatherapist or, people who know more about each of these areas will share your knowledge with me and with the whole community. And then lastly, the Ayurvedic practice of Abhyanga or sesame oil massage is absolutely wonderful for trauma survivors. I use this a lot in my practice. And I think there's a tendency for us to sometimes underestimate practices like this and how effective they can be. But getting people to do Abhyanga can really help with grounding, can really help with coming into their bodies, feeling their bodies more. And it is a very, very calming practice. So I really, really encourage working with that, and try it for yourself, practice on yourself and see what effects you get. And you'll be able to be that much more convincing in getting your clients to give these things a try. So here are the questions that I really have, that I have no answers to these. And I'm hoping that my colleagues who are doing amazing work will engage with this and share your thoughts with me, and we can keep forwarding our role as herbalists in supporting people with trauma. So the first question I have is really about some of the scopolamine-containing herbs, henbane, and these very, very dangerous plants that also have some sort of psychoactivity and a lot of activity on the heart. There has been some really interesting research using low-dose transdermal application of scopolamine for people who have heart attacks. And one of the things that happens when people have a heart attack is that sometimes if they don't, you're not immediately killed by the heart attack itself. The body can go into this sort of vagal shutdown, and that the positive, myelinated vagus doesn't turn back on and help to regulate the rhythm of the heart. And there has been some research that's been replicated a couple of times using scopolamine transdermally, and having really good effect on people actually recovering that healthy vagal tone. And I have just a lot of questions about whether there is an application for trauma here, and possibly even for not just trauma, but for other syndromes where we have sensory issues because of that kind of myelinated vagus, the vagal tone being lacking. So yeah, maybe a return of flying ointments, but for a very different purpose. I don't know. I'm curious. And then I have an ongoing question. I have no personal or professional experience with psilocybin-containing mushrooms. But I have a lot of question about what role we as herbalists could be playing in the ongoing discussion about whether or not this is a legitimate therapy for trauma recovery. There's a lot of evidence to suggest that it is. And what would be the best practices in terms of delivering and preparing the medicine itself and integrating with other professionals in order for people to get the best kind of healing results possible from working with entheogenic mushrooms. These are my two growing edge questions, and I really do want to learn from and connect with as many of you as are interested about developing and kind of continuing to grow our knowledge about working with herbs and trauma. So we've come to the end, to our Q&A portion. This is my email address, melanie@psycheandsoma.com. I will include that for you in the email, along with some ideas for further reading, and some ways of contacting me if you're interested in consulting, whether as a client or if you would like some feedback or support on cases that you might be working on. I'll send all of that to you. And I'm going to go ahead and we'll move into Q&A. So I am going to have to change that screen view there. Oh my gosh, I'm not kidding about going over time. Okay. Oh, thank you so much. Thank you, Aquila, for saying this was a fabulous call. Why do you think the bitters would feel better after a meal? Okay, your body feels more settled when you take bitters after a meal. You have chronic digestive issues. I'm not sure why that might be. The first thing that comes to me is possibly if your bitters are aromatic bitters, and possibly by having the food go in first, it's slowing down. Like maybe it's not so much that you're not secreting adequate digestive juices, but maybe it's more that actually you have some issues further down and need actually more of that carminative effect of helping to release, gas and bloating and that kind of stuff. That would be my guess, but I don't really know. The body is very mysterious. Drops of lobelia and passion flower tinctures. Yes. I'm talking about the tinctures when I mention those herbs. Lobelia needs to be, if it is a tincture, it needs to at least have some amount of an vinegar extract. I don't remember the proper term for that, but all of the compounds will not extract fully in alcohol, so it's got to have some vinegar as well. Okay. Okay, Elizabeth, I'll make sure to send some breathing stuff in the email. Okay, Karen is asking, what about when the trauma starts at birth? A very traumatic birth, serious life-threatening issues, trauma in the NICU, ongoing medical issues. How do you work with someone who has never known a trauma-free life or what it feels like to truly feel good? Yeah. So I am just going to tell you this straight from my heart and my experience. I have a client. Um, I don't know. I don't know her story. I don't know what her trauma is, but I know it's very severe. And we have been working together for maybe, I don't know, 7 years, maybe. Yeah. And it took a couple of years of trust building before I felt that she would accept a referral. She's working with the best psychotherapist in town that I know for trauma, and it's one day and one session at a time. And there are times when I see her and I see her feeling better, and I can see the signs, and I see her taking it in. And then sometimes 2 weeks later, it's been shut right back down. And so the best thing that I know is get people working with trauma-informed psychotherapy for sure. You cannot do the function of helping to restore normal development where it didn't take place. That's something that a psychotherapist needs to do. Karen, if you are a psychotherapist, then you know how to do that better than I do. And so I think that's one piece. And I think another piece really has to do with this idea of aesthetics, because it's like if they don't know what it's like to truly feel good, the best thing that I know to do is to use your creativity and empathy to tell them a story about what it might feel like to feel good. To, to say something like, you know, what would it be like if, we could come up with a really calming ritual that you could do before bed, like maybe 3 things that would feel pretty good to you. Um, and it might take a little while to come up with that together. Um, Ask them for images of what does it feel like in their body when you catch them feeling a little better or a little bit more kind of integrated. Ask them to verbalize how it feels, or to put it into an image. I had a client yesterday going through this, and she described her anxiety as like a gerbil in her belly, constantly going. And then I asked a time when she feels pretty good. And she said, well, it's when I'm teaching or presenting. And I said, okay, well, what is the image of what that feels like? And she said, it's like a buzzing through my whole body. And she couldn't give me a lot more words. A lot of times in the beginning, people will have a really hard time describing these things. But we got a little bit of language about, the image of the gerbil versus the even buzzing through the whole body. So starting to help people realize that they have felt good is really important. And then, giving them medicines in addition to whatever, you need to do to treat the patterns that are there. Giving them really beautiful aesthetic medicines, giving them aromatherapy options, giving them music assignments to listen to. I think that's the best. That's the best that I know. Thank you, Yoko. That was my hope, mostly to be heartfelt. So I'm glad that that came across. Yeah, ayahuasca is being used for PTSD. I think iboga is also. I think iboga is more being used with addiction recovery, but I think there's also some exploration with PTSD. Jennifer says it would be really cool to set up evidence-based research with partnering with a psychologist or psychotherapist with the psilocybe question. Yes, I've heard of research of clinical uses of LSD to help those with PTSD-related trauma. Yes, I would love to be a part in any of that research or to learn about it if people do it. Jennifer says, I know this is an herbal talk about trauma, but for those who are therapists, I know that in the state of Texas, they can sign up to learn NADA protocol, stimulates vagus nerve auricularly. Just wanted to throw that out for people possibly to look at. Awesome. Yeah. Thank you so much, Karen. So Lisa, if you want to talk more about this commingled Hashimoto's and PTSD, email me or get in touch. I think that might be something easier to address one-on-one. And then Ala Shakti is sharing that she's seen some people who specialize in trauma but have really not listened compassionately, or they've asked irrelevant probing questions. And she says, I've found in my own experience as a survivor and in my clients' experiences, many herbalists who have claimed an interest in trauma are unskilled and re-traumatizing. How can we combat this reality? Well, I think there are a couple of answers. I think one, personally, the best that I know to do is to try, to keep learning and to be mindful of how I feel, because sometimes I think these things that practitioners do that are re-traumatizing are coming from their own trauma or their own developmental trauma, ways that they have not learned how to relate with another human being. So I think continued work on myself and on ourselves is vital as healers, both education and also just personal healing work. I think that's one part. And then I think the second part is that I think that there's a problem in herbal medicine with the lack of really a clearly articulated ethical standard, and any real recourse or way of disciplining people who don't meet that standard. And licensure is not required in order to have a cohesive set of ethics and to have accountability to one another and to our clients about how we are working with those ethical standards that we create for ourselves. I think it's a really big piece that's missing. And it doesn't just have to do with trauma, but it certainly includes this. And certainly the consequences for trauma survivors who go to receive care and are re-traumatized is, pretty tough. Part of why I, as imperfect as my knowledge is, I wanted to do this talk. So I really hope that in the next 10 years we see growth in this profession. I think the world really needs us. And I think that we have some, in a way, like we have some growing up to do, despite like the ancient legacy of this tradition. I think that we need to have standards, and I think that we need to have accountability with each other, with our communities, and with each other. I don't have the answer for how to implement that, but I'm very interested in talking about it with anyone who wants to. Very, very interested in talking about it. So thank you for raising that. And I'm sorry that happened to you. Okay. All right, my dears. Well, thank you all so much. Please reach out by email, and I hope that this has been supportive and will support you and your clients. And I hope that it just is like the opening of a portal, and that we can work together to develop even more knowledge in this area specifically. I'm looking forward to hearing from any and all of you who would like to keep going in that. Lots of love to all of you. Thanks for staying on for 2 hours, some of you guys. 50 some of you who've been on for 2 hours. Thank you. And I will talk to you really soon and send the recording out as soon as I can, probably tomorrow. Okay? All right, everybody. Take care. And if you're on the East Coast, please be safe in this coming snow that we're going to have. Okay. All right. Take care, everybody.